And as I mentioned, Stano has actually drawn a very good picture today, our editorial cartoon that actually shows or epitomizes the state of healthcare in the country and how people are suffering. And we want just to also throw this to our panelists. Health is a big issue. Even we can touch health with security in this country. And I wanted you just to comment on this particular cartoon. We can begin with you, Irungu Houghton, who is Executive Director of Amnesty International. Looking at that editorial cartoon that we have on the screen right now, and in relation to the story of Murage, just done by Zainab, you know the story. What does it really showcases about our state, or the state of play, as far as healthcare is concerned?
So good morning, Debal and fellow panelists, once again. So I think the first thing is, I think for me there's been a lot of attention on Boniface Murage, but I think actually the focus really should be on Wangeshi, the mother of the baby that was being held for I think up to 4 weeks for this bill of 56,000 shillings. And if anybody has ever wondered what is the cost of the billion shilling scandals that we see within the Ministry of Health, or the inability to provide free maternal health care for all the women and girls in this country that require it. This is really the face of that scandal. And I think for me, once again, we're just it's a wonderful story in one. It's a very Kenyan story, right? So he's arrested, and actually, let's put it this way: a father breaks the law to protect his family, right? And the question we should ask as Kenyans: what does that mean when somebody actually breaks the law in order to protect a newborn and a wife? What does that mean about the system that would lead to somebody essentially putting themselves in the position of a criminal? The second part of it, which is interesting, is that well-wishers immediately flock to support. So we had the offer from the courageous administrative police officer who rescued people in Dusit. We also had the county governor in Nairobi offering to actually paid the bills and then offering to provide a job. It's a very Kenyan story. But the other part of the Kenyan story is nobody is asking, why is our public health system continuing to fail women like Wangeshi? Let me leave it there for the others.
All right, let's say from Ambassador Rasas Mwenche. Good morning.
Well, we'll come back later on to our story that we talked about earlier on, but good morning. Depal and my...
We talked about so many other stories, particularly this one.
The African Union, but let's talk about this one.
Yes, please.
It is indeed one of the human rights that is in our constitution, that access to medicine and all that, and this is one of the 4 agenda that Kenya is pursuing, health for all. What was interesting, and I want to build on what Irungu has said, is the determination by the court that actually this was not theft. It was denying the hospital funds, precisely for what Irungu has adequately, argued on. And I think the fundamental issue is that it exposes how people are suffering out there. Because when you say that free maternal health services, what does that free maternal mean? Is a child not a product of that maternal? Are you only recovering the mother? And where does this line stop? Is only in private hospital, public hospital? I think this is a question that I would hope that the CS Health should now sit down and reflect on this and find a solution, because it's really, there are many families there who are suffering, who die in homes, because if you go to the hospital and you're subjected to this kind of thing, then you better stay at home. So what are we talking about? Because a child being born, that is the beginning of the nation, and that we should protect life. If you imprison a child in a hospital, what are you saying to the nation? But we should commend the lawyers and all those that, and even the court, for having reached this verdict, and that this family is home. But how many more we don't know today?
We don't know today. And that's the reality on the ground. Let's hear from Professor Naomi Damba.
Dubal, 2 years ago, I addressed the insurance executive in Naivasha. And my focus was the insurance in this country is only focused on a thin layers of people, which is the middle class, and anybody above. And every single person, Mama Mboga, below, is not an insurance focus. So what the English call externalities of the insurance is that they don't cater for us. And so we won't try. And then insurance is focusing on treating really critical persons when people are going to hospital to die. And therefore, somebody can, most of the time, I don't say somebody, in terms of cancer, cancer moves from stage 1, stage 2, stage 3, stage 4.
Yes.
And when you get to stage 4, you are about to die. And that is when insurance is responding. So at the university, I said any insurance we must have must provide pre and post-natal care. And most of the insurance that we had could not do it, so I asked them to leave. And there is only one insurance who come forward, which is now providing pre and postnatal care and also pre-screening for all the university staff. And I think they're the only insurance. And we are one of 4 universities which is doing that. So the point is, we need a universal health care. A healthy nation cannot be without healthy citizens. And therefore, we all need to focus on government role and also the private sector role.
Yes.
The kind of thing that James Mwangi did with the bank system. When Barclays and Standard Bank were closing any account that's less than $20,000. James Mwangi came up with a very innovative program. If you have a goat or a few potatoes, sell it and I'll open an account for you.
Thank you.
That is what insurance need to do.
Thank you very much. Let's hear from Omai this morning. Dr. Njoki.
I think after this, the structural adjustment programs in Kenya, probably the worst thing that happened to us is corporatization of healthcare and corporatization, of course, of many other public goods. And we need to rethink that. It's very sad to see members of parliament and all these leaders throwing gifts and jobs, and I think, which is all good. It's very good, especially for Murage.
Yes.
And the many other this kind of things that happen. But we need to go back to policy making and changing the law. I think it's, of course, there are many interests. There are the doctors also who, to be honest, also have been quite unethical along the way. We have insurance companies. There are so many blocks of interests. Of course, COTU, in terms of, and all these have been, over time, I think we've had debates about, in terms of contributions to, if we actually, to make proper contributions for a universal healthcare system. But I think it's urgent, and the leadership in this country, these two cases, the last 2 weeks, needs to actually make them see that we can no longer continue this state of being. It's really, really sad what this man and the woman had to go through.
Right. I don't know if Moses Tofo, you have anything to say regarding this. I know this is such a Kenyan issue, but maybe you've been here and you can tell us your perspective. And of course, we shall be discussing what is happening in Zimbabwe much, much later. But looking at our healthcare compared to what is happening in Zimbabwe as well, is there any comparison? Of course, we know how the economy has been tanking in light of the political scenario in Zimbabwe. Maybe you can just give us a snippet of what you see here and what you've observed also in Zimbabwe.
Yes, thank you. Good morning, everybody. I think that in terms of the healthcare system in Zimbabwe, the system has been deteriorating over the years, especially starting from 2000, when the country started to experience a lot of socio-economic challenges, which are actually related to the issue of bad governance, you know, policy paralysis on the part of the government. So if I'm to compare Zimbabwe and Kenya, I will tell you that Kenyan health system, despite the challenges that you are talking of, is actually far much better. In Zimbabwe, we have witnessed so many lives which have been lost, which could have been saved had it been that there is a robust health system in place. If you look at our public health institutions, you will be surprised that you go there, you don't find basic stuff that should be used to take care of patients. So, yes, there are challenges that are here in Kenya, but in Zimbabwe it's a very desperate story in terms of access to health. But emphasizing on what my colleagues have said, you know, healthcare is very essential, and we need to put the human being at the center of any health delivery system. Even not only health, but any human endeavor, we have to put the human being in place. And it is very important to ensure that health services are accessible, especially to those who are marginalized and those who are poor. So this is a very, very sad story. Yes, for
Thank
Kenya,
you.
yes.
Thank you, Moses. And just to read also some of your reactions there on social media, we have Stephen Kabuoro who is saying that Boniface Murage is just one case. There are many more cases resembling his in this country. Just a reflection there. Also, Bing Charlie says, deep reflection as usual, looking at that particular editorial cartoon over there that was drawn today by, this is Stanoy in the People Daily, and this is what we were discussing, just the current state of play of healthcare in this country. Also, Franklin Furaha says that's what we need as Kenya, to see no impunity anymore, to see no impunity anymore. And most of them are trickling in. We shall be reading some of them, I'm sampling some of them much later in the course of a program. And there we go. Those are the pictures right now. At least we can see the First Lady, and this is John. What was it? You don't go remind me the name of John Wakihuri. What was the name? Yeah? Douglas. Douglas, yes. And she's been also a personal trainer to the First Lady. There they are, they're warming up. They're just about to launch that is, if we just take the pictures in full screen right now, to launch the 5th Beyond Zero campaign. And we shall be giving you, of course, details of this much later in the course of the program. But if I may just cross over to you, Enongu Newton, what the First Lady began, what do you think has actually done to the maternal healthcare? Has it brought any discernible difference as far as that is concerned in relation to what we saw this morning with Murage, or that particular story?
So first of all, let me just declare my bias. I'm a fan of the First Lady, as I call her. Most people call her the First Lady, but I think First Lady is probably apt. I like the idea that she's out early exercising with Kenyan runners. She brings together, I think, two sets of our challenges. One is, of course, to retain our leadership globally as a marathon, award-breaking or rather record-breaking nation, but at the same time also the challenges of maternal health care. So I think she brings that into focus. I've always felt that she's been undermined, and in many ways her efforts have been sabotaged by the corruption that we've seen in the health ministry, not just at the level of the national ministry, but even at the county government level. And many times, I think, if you go back, the last time I think she ran a marathon was just before the 6 billion or 5 billion scandal, the so-called Mafia House scandal that happened in 2015 or 16. And that really she went on pause after that, because I think probably what was understood by the by government officers that she would no longer be able to essentially rally the nation on a maternal health care agenda in the presence of such corruption. And I think looking back at those two things, what for me is still present is that in many ways, despite the Ethics and Anti-Corruption Commission report on the Ministry of Health, they did a systems audit, and they confirmed quite a bit of what had been essentially leaked by the internal auditor back in, back during the time of the 6 to 5 billion scandal. My sense is that not much has changed. Many donors have pulled out of the health budget. They no longer fund us because of the scandals related to that particular incident, but also the Gavi scandal, where money was essentially misallocated and paid back without anybody being held responsible for that. So I think those would be my views, that once we are able to close the loopholes for corruption within the Ministry of Health, and within our county governments,
Yes.
we are going to be able to see a country that can declare not just piloted universal healthcare, but really national universal healthcare across the country.
Right, thank you very much. And of course, the pictures are very sporty. They're tearing on air right now. That is, of course, I love pictures coming from State House. Once they stabilize, we shall be showing you this particular 5th launch of the Beyond Zero campaign, which has gone, you know, farther to make sure that maternal health care in this country is also raised up to a very good, maybe solid, what I should say, antenna as far as healthcare is concerned, and mothers who are suffering in the hospitals as far as bills are concerned. Maybe, Ambassador, you can just comment on this as far as the Beyond Zero is concerned, and Joki as well.
Let's talk about the principle behind this, because if you look at statistics, about 90% of women in Kenya do get what do you call it? Prenatal access services to a qualified professional that, you know, assists them in terms of the fetus, how the baby's, you know, faring on. But when you go further down the road, when it comes to delivery, less than 50% of births take place in hospital.
Yes.
And if you look at, you know, demography in terms of deaths, Kenya records about 500 in about 10,000 births that die. The statistics, particularly in developed countries, is below 50. So that tells you there's something wrong. From those statistics, you can read there's something wrong. Beyond Zero campaign is meant to, that if a mother is giving to life, that mother should be protected, and equally the child should be protected. And I think this really should bring us to what Professor was articulating early on, particularly the role of government and insurance companies. This cannot be just government alone. Granted, government should provide the leadership, but I think here is an opportunity. The problem with our insurance companies, they are extortionists. They can only insure you if they think you will not die. They do a model where they see what is the probability that the child might die soon, and they will check on your hospital data. In fact, this situation now, as we move to biometric, the insurance will be getting all that data. They can even get into consultation to know the probability for your death and refuse you insurance. And this is a big issue globally, but also in Kenya. But here's a because if you look at the death rates against the population, if you get the population to insure, the hospital will still make money as a service, and they may not make handsome profits, but you will protect the life. Nobody is being proactive to look at the potential. Today, you and I don't know how it is with you, but there is no week that ends without participating in a funeral. Nobody's, for instance, ensuring on how we can protect the people once they have a loss in the family. They have already spent all the money they had in the hospital, then there's a funeral, and unfortunately in Kenya, funerals are a big time thing, so that by the time a loved one has died, a family is left very poor. In fact, in a very bad state. So this is a very serious matter that we should all deliberate and come up with innovative tools to save, you know, the suffering people out there.
Thank you very much. Dr. Njoki?
I think it's just probably like what Ambassador here is saying. We need to get, the government needs to really rein on insurance companies, and also for those insurance companies to remember first, we are all human. I think saving lives is the most important thing. But also, every week, everybody is contributing towards hospital bills in Kenya, beyond, and then the funeral. So I think we need to do something about it. Insurance companies, the government, and I hope Beyond Zero, what the First Lady is doing, she can start to lobby more. I know she comes off also as just trying to help the healthcare system, but I think given the role she has been playing, she needs to now actually take up a role advocating for better regulations and a more humane also insurance system. So even talking to insurance companies and also the doctors who are also largely also doing a lot of extortionist work. Doctors and insurance companies. And so poor Kenyans are left to the mercy of God. And it's really, really sad. If you don't have money in this country, it's only God who can save. It's so sad.
Yes, sir.
Yeah.
Right, thank you. Unless Professor Nomi Dambo, you have something to add on it?
I'd like to congratulate the First Lady for continuing this effort to put it in the public, and the world is a crisis. It is a crisis that should not reach the stage where it is, where this young man has to carry his baby in a bag. We can do better as a country based on the stage of our development right now.
Thank you. Right.